Hello everyone, welcome back. In today's session, we'll be studying another important topic from pediatric nursing, that is celiac disease or celiac sprue. That is a gluten-sensitive enteropathy or tropical sprue. So what is celiac disease? It is a condition in which affected child has the immunologic intolerance, inability to digest to gluten protein. Okay, so basically it is a condition where the child has the intolerance to gluten protein, in simple word. Okay, so now the question is where gluten protein is present. That is in wheat, barley, oats and rye. So glutamine, it is a non-essential amino acid. It starts to accumulate into body, which destroys intestinal villi, so disturb absorption process. Okay, so basically it is a non-essential amino acids and it will accumulate into body because there is like no digestion, right? There is intolerance, so that will destroy intestinal villi and it will further disturb absorption process. Clear up to this? So sprue means a disease of the intestinal tract characterized by malabsorption, weight loss, abdominal distension, bloating, diarrhea and steatorrhea. What is steatorrhea? That is fat present, like unabsorbed fat present in stool. Okay, so basically it is a intestinal tract disease, right? Sprue means a disease of the intestinal tract characterized by malabsorption, weight loss, abdominal distension, bloating, diarrhea and steatorrhea. So now coming to clinical manifestations. That is symptoms appear between 1 to 5 years of age. Okay. Then chronic diarrhea will be present, foul, greasy and bulky stool, that is called steatorrhea. Stop to increase weight and height, that is prominent sign. Then muscle wasting will be seen mainly into buttock and extremities. Then abdominal pain and distension. So all three will be seen in the baby who is having celiac disease. Now coming to diagnosis part. So increased level of TTG IgA. What is TTG? That is tissue transglutaminase IgA or IgG. Okay, that level will be increased. So where it is used, a tissue transglutaminase IgA and or IgG test is used for evaluation of certain autoimmune condition like celiac disease. So basically it is a profile to evaluate the autoimmune condition like celiac disease. Now we are discussing. There are many other autoimmune diseases as well. So this transglutaminase IgA or IgG, this immunoglobulin will be checked. Clear? And autoimmune disease can occur when the body's immune system mistakenly perceives a non-threatening subject as foreign invader in case of people with celiac disease. So gluten as a foreign invader and attacks it. So basically I am telling you in clear words. See, our body is having own parts and own system, right? But now due to that autoimmune condition ना, so our body it will start to perceive, मतलब क्या है, मतलब वो सोचेगा कि बॉडी के अंदर जो है ना उसको ही वो थ्रेटनिंग सब मतलब फॉरेन सब ये समझते हैं, फॉरेन इन्वेडर समझते हैं, इसलिए उसके ऊपर अटैक करते हैं. सी इन केस ऑफ पीपल विद सीलियाक डिजीज, ग्लूटेन एज अ फॉरेन इन्वेडर. ना वो ग्लूटेन को भी समझ रहा है कि वो एक फॉरेन इन्वेडर है एंड इट विल अटैक it. Clear? So our own immune system is attacking our gluten protein. Now this immune system response in celiac disease also involves the production of antibodies directed against an enzyme normally present in the intestine called tissue transglutaminase. That's why we are checking the level of tissue transglutaminase, because if our immune system is responding to the gluten protein, as I have told that it is taking gluten as a foreign invader, right? So then we can see the presence of this tissue transglutaminase in our system. Clear? So that's how we will diagnose it. Now coming to management part, advice to eat gluten-free diet like corn, rice and millet. Now already body is having enough gluten and body's immune system is attacking gluten. So we are not giving further gluten to the patient. So patient is advised to take gluten-free diet like corn, rice and millet. Then advice to avoid gluten-rich diet like wheat, barley and oats, rye. Okay, so all gluten-rich diet will be avoided. Then give minerals and vitamin supplement. Clear? Then instruct parents to take measures to prevent celiac crisis, rapid onset of dehydration and metabolic disarray in fulminant celiac disease. Okay. So we will instruct the parents to take measure to prevent celiac crisis. What is that? That is rapid onset of dehydration and metabolic disarray in fulminant celiac disease. Clear? So here in celiac disease we have discussed about which type of disease this is, its clinical manifestations, its diagnosis and its management part. Hope you have understood. If any doubt is there, please let me know. Next is rectal prolapse. What is that? That is protrusion of one or more layers of rectal wall through anus. So now coming to types, which all the types of rectal prolapse, that is mucosal prolapse, that is only prolapse mucosa. Then procedentia, what is that? That is prolapsed all layers of rectal wall, like complete prolapse of lower bowel. So there is two type of prolapse, that is first one is mucosal prolapse, that is only prolapse mucosa, and procedentia, what is procedentia? That is prolapsed all layer of rectal wall, complete prolapse of lower bowel. Now coming to cause, what all are the causes? That is constipation for long time, chronic diarrhea, anal surgery, prolonged sitting, excessive straining during stool passage. So if patient is having chronic constipation, right, long time मतलब क्या है, बहुत दिन से उसको constipation है, जितना सारा मतलब bowel disease है ना, main cause, main risk factor is constipation. Every problem starts with constipation. Then chronic diarrhea is there, anal surgery was happened in past, that is also a major risk factor. Then prolonged sitting, मान लो कोई सेक्टर में काम करता है या स्टडिंग या मतलब ज्यादा टाइम बैठे रहते हैं ना. Then excessive straining during stool passage. All this can be the cause. Now coming to clinical manifestation. So what all are the clinical manifestation? Visible part of rectum outside which looks red to dark purple in color. Okay. So basically it will be seen from the outside and it will look like red to dark purple in color. Then rectal bleeding and constipation. All these symptoms will be seen. Then management part, correct the cause of prolapse like constipation, diarrhea, malnutrition. So हम वो जो underlying cause है ना, उसको हम पहले correct करेंगे, ठीक है. उसके बाद क्या करेंगे? Manual replacement. Then we will provide fiber-rich diet that will help for constipation, right? And provide head-low position. ठीक है. का मान लो head part and patient is lying like that. Now we'll put patient's head down and leg up like this position, right? Yeah. Hope it is clear. Next topic, see, anorectal malformation, ARM or anomalies. So what is that? Abnormality in the formation of lower end of alimentary tract, that is anorectal area. Alimentary tract में क्या है? Abnormality in the formation of lower end of alimentary tract. Clear? Now coming to types. What are the types now? With visible abnormal opening of bowel, that is stenosis of anus, anoperineal fistula, anovestibular fistula in female baby. So these all are the types. First one, okay, then with an invisible abnormal opening of bowel. So what is that? That is rectovaginal fistula, an opening between rectum and vagina in female baby. Rectourethral fistula, that is opening between the rectum and urethra, that is in male baby. Then rectovesicular, what is that? An opening between rectum and bladder, both male and female. So what are three that? See, rectovaginal, that is for female baby, between rectum and vagina. Rectourethral, that is between rectum and urethra for male baby. Then rectovesicular, that is between rectum and bladder for both male and female child. Clear? Then next one is no manifested opening of bowel. Third type is, that is no manifested opening of bowel, that is anal membrane atresia, anal agenesis, that is anal atresia or imperforate anus, then rectal atresia. These all are the types. Then rectal agenesis में क्या है देखो. Agenesis means failure of an organ or part to develop or grow. Agenesis का मतलब ही है, उसको मतलब क्या है, failure of developing or growing, right? So it accounts for 75% of all AIIMS. Clear? This anomaly present with fistula in male between posterior urethra and rectum, and in female between upper vagina and rectum. मतलब इसमें हम फिस्टुला देखेंगे in male between posterior urethra and rectum, and in female between upper vagina and rectum. ठीक है? Both for both male and female, its position is different. Now coming to imperforate anus or anal agenesis, what is that? A condition in which the anus is closed or absent. मतलब उसमें कोई opening नहीं है. ठीक है? See, imperforate anus or anal agenesis. Anal agenesis देखो, a condition in which the anus is closed or absent. Then it accounts for about 80% of anorectal malformation. ठीक है? देखो पहले क्या था, रेक्टल ये है 75%, ठीक है, और इम्परफोरेट में क्या है 80% प्रेजेंट है. उसमें क्या हो रहा था, उसमें फिस्टुला प्रेजेंट था रेक्टम एंड यूरेथ्रा के बीच में फॉर मेल बेबी, एंड वैजाइना एंड रेक्टम के बीच में फॉर फीमेल बेबी. एंड इन दिस केस इम्परफोरेट एनस में हम क्या देख रहे हैं, इट इज अकाउंटिंग 80% ऑफ टोटल AIIMS, एंड इट इज अ कंडीशन इन व्हिच एनस और एनस ओपनिंग इज क्लोज्ड और एब्सेंट. क्लियर? नाउ कमिंग टू टाइप्स. व्हाट आर द टाइप्स नाउ? सो लेट्स सी. See, low imperforate anus, that is distance between blind pouch of rectum and anal dimple less than 1.5 centimeter. So what they are saying, that is low, in low perforate anus में distance between blind pouch of rectum and anal dimple less than 1.5 centimeter. High imperforate anus में क्या है, distance more than 1.5 centimeter between blind pouch of rectum and anal dimple. इसमें 1.5 सेंटीमीटर से कम है, उसमें 1.5 सेंटीमीटर से ज्यादा है. नाउ कमिंग टू क्लिनिकल मैनिफेस्टेशन. नॉट पास मेकोनियम. ओके, बेबी जनरली पास मेकोनियम between 24 to 48 hours, right? But if baby is not passing meconium after birth, then it could be possible for AIIMS. Okay, we have to look for it, we have to assess that baby thoroughly. So let's see. Then next one is absence of anal opening, so catheter not passes into rectum. If there is no opening, then how we will pass the catheter, right? So that is also a clinical manifestation. Then there is a presence of fistula in male. We have already seen between rectum and urinary bladder, urinary tract or perineum, that is rectovesicular. In female, between rectum and vagina or perineum. Clear? Then green tinged urine, if fistula present, that is meconium, come to urine and vagina. All these symptoms will be seen in the baby. Clear? Now diagnosis में क्या है? A gloved finger or thermometer cannot be inserted into the infant's rectum. If we are going for checking the temperature of the baby, sometimes what we are doing for core temperature, we are using rectal route, right? So that time we can observe that thermometer also cannot be inserted, and even a gloved finger also cannot be inserted into infant's rectum. Clear? Now coming to surgical management, it depends on type of anomaly. In anal stenosis, manually dilate stricture continuously for 4 to 6 months may be done by Hager's dilator. Okay, so if anal stenosis is present, then what we are doing? We are manually dilating the stricture continuously for 4 to 6 months may be done by Hager's dilator. We have seen Hager's dilator in OBG, right? OBG instrumental part, we will be discussing about the Hager's dilator. So here also we are using Hager's dilator. In anal membrane atresia, make hole by blunt instrument. Okay. In case of anal stenosis, we are using Hager's dilator and we are continuously trying to dilate the stricture manually for 4 to 6 months. But if anal membrane atresia is there, then we have to make a hole by blunt instrument. Then imperforate anus में क्या कर रहा है? Low imperforate anus perform perineal anoplasty. We are doing perineal anoplasty. Then high imperforate anus में क्या है? 2-stage repair is required. क्या करते हैं? फर्स्ट स्टेज में देखो, फर्स्ट क्रिएट अ टेम्पोररी कोलोस्टोमी ओपनिंग इन कोलन थ्रू एब्डोमिनल वॉल टू प्रोवाइड आउटलेट फॉर द स्टूल. देन साइड्स फॉर कोलोस्टोमी एंड टाइप ऑफ डिस्चार्ज. सी फर्स्ट में क्या कर रहे हैं? हम एक टेम्पोररी कोलोस्टोमी बना लिया, ठीक है. नाउ ओपनिंग इन कोलन थ्रू एब्डोमिनल वॉल to provide outlet for the stool. Then sites for colostomy and type of discharge. देखो ascending colon में क्या कर रहा है? देखो अगर पेशेंट का ascending colostomy कैसा होता है? ऐसे ऐसे होता है ना, ऐसे ऐसे होता है, फिर ये वाला, फिर ये डिसेंडिंग, ये ascending पार्ट है ना, ये ट्रांसवर्स पार्ट एंड ये हमारा डिसेंडिंग पार्ट. सो अगर ascending colostomy मतलब somewhere here, so I am showing you somewhere here if it is present, then colostomy in ascending colon discharge fluid feces, है ना. यहाँ से अगर जाएगा, यहाँ से अगर colostomy किया है तो हमें जो fluid feces मिलेगा. Then hepatic flexure में क्या है? Right colic flexure colostomy, that is colostomy near hepatic flexure and discharge will be semi-solid feces. If we are doing right colic flexure colostomy or hepatic flexure colostomy, that is near hepatic flexure, discharge semi-solid feces, है ना. Then transverse colostomy में क्या है? देखो transverse मतलब somewhere here, this side. Clear? If we are doing here, then it will be marshy feces will be present. Then splenic flexure में क्या है? Left colic flexure. That is colostomy near splenic flexure. Discharge will be semi-marshy feces. Then descending colostomy में क्या है? Colostomy in descending colon, discharge of solid feces. If somewhere here, then it will be solid. ठीक है? Due to position, that consistency will be different. Clear? Now colostomy irrigation procedure देखो क्या है. First irrigation should be on 4th to 8th post-operative day. Then give supine or left lateral position. Insert catheter 5 to 7.5 centimeter in colon after lubricating by petroleum jelly. Now in colostomy irrigation, what are things we are doing? We are positioning the patient in supine or left lateral position. Then we have to insert catheter 5 to 7.5 centimeter in colon after lubricating by petroleum jelly. Clear? Next is use 60 to 200 ml lukewarm saline solution during irrigation. Then keep enema can 10 centimeter above colostomy level. So हम अभी एनिमा को क्या है 10 सेंटीमीटर अबव कोलोस्टोमी लेवल में रख देंगे. ठीक है. नाउ कमिंग टू सेकेंड स्टेज में क्या है देखो. सेकेंड स्टेज डेफिनेटिव सर्जरी में पुल थ्रू सर्जरी. तो इसमें हम क्या कर रहे हैं, दिस इज कॉल्ड पुल थ्रू सर्जरी. ओके. Rectal pouch brought down and sutured over the anal dimple at age of 6 months to 1 year. Or gained 8 to 9 kg weight. If baby has gained weight of 8 to 9 kg और बेबी का एज कितना है 6 months to 1 year है, तब हम सेकेंड स्टेज सर्जरी करेंगे जिसको हम पुल थ्रू सर्जरी भी बोलते हैं. इसमें क्या करते हैं हम रेक्टल पाउच नीचे लेके आते हैं एंड सूचर कर देते हैं ओवर एनल डिम्पल. नाउ पोस्ट ऑपरेटिव मैनेजमेंट में क्या है, गिव साइडलाइन पोजीशन विथ फ्लेक्स्ड लेग और गिव prone position in hip elevate to decrease edema and pressure at surgical site. हम अगर साइड लाइन पोजिशन दे रहे हैं एंड लेग फ्लेक्स कर देते हैं और नहीं तो प्रोन पोजिशन देते हैं इन हिप एलिवेट टू डिक्रीज द एडिमा एंड प्रेशर एट सर्जिकल साइट. देन वी हैव टू कीप द सर्जिकल साइट क्लीन एंड ड्राई. वी हैव टू मॉनिटर फॉर रेडनेस, स्वेलिंग एंड ड्रेनेज फॉर इन्फेक्शन. ओके. कंटिन्यूअस असेसमेंट पार्ट इज नीडेड. इफ मान लो अगर पेशेंट का ये सब चीज दिख रहा है तो वी हैव टू मॉनिटर दैट. सो होप इट इज क्लियर. कीप स्टडिंग एंड थैंक यू सो मच.